Did mention, Anaeko is a Belfast-based software company. We've been in operation for about 15 years, and we specialize in data, cloud data management and migration, and data analysis. And we work for very large-scale projects and companies such as IBM. We help them with their cloud infrastructure, but we also work on challenging analytics projects. For example, we currently are engaged with NI Water on a wide range of problems covering things like pumping efficiency, leakage detection, and geospatial population. But of course, today I want to show you a little bit about a few highlights anyway from our recently completed project, Clean Air for Healthcare. I'll just briefly explain what it is, and I'll have time for a couple of examples of the kind of things that you can do with it. So as part of a collaboration with HSCNI and the Belfast City Council, we took part in a project to study the impact of pollution on long-term health problems. And that included looking at ways of supporting care and self-management for chronic respiratory problems. Now, the numbers on the screen have already been laid out at the start of this webinar, so I just really want to highlight one of them. And that is the 10,000 critical care admissions every year, and about 50% of them are readmissions after about 6 months. So this is a kind of a personal thing. I would say that if you were to embark on any initiative to try and improve respiratory care, that would be the metric. That would be the metric I would like to target, to see that trend down, because at the minute it's trending up, and especially in children. So Clean Air for Healthcare was a key output of that collaboration with the HSCNI. And it's a data hub that where we brought together data from 11 different organizations to build a healthcare research hub and a platform for application development. Now, there's a list of kind of topics that it covers on screen, and that's really just a subset of what it has available. There are literally hundreds of millions of data points covering dozens of different aspects of life in Northern Ireland. And they're all linked, and they are especially linked geospatially. So the core driver of this consolidated data set was to take that geospatial look and to layer in pollution and localized pollution and how it can impact people. So we've integrated an extensive historical record of data going back 10 years, but we also have real-time pollution feeds and from IoT sensors. So we have linked into DERA's data sets, and we connected into third-party pollution sensor networks, but we also deployed our own sensors. Now, the reason that we did this is partly because of the coverage in Belfast is quite poor for these kind of things. So we wanted to get that nice, if you look at the map on the left, that nice west to east and north-south corridor of collection. But actually the key reason for developing our own sensors and putting them out there was that we wanted to target pollution in the home. Now, this is something that's fairly underserved, I think, at the minute. And you can see an example on the right, where the red line is the internal pollution of a suburban home, and the background is what's happening outside. And one thing just to pick out of it is that you can see spikes. There are spikes in the pollution that could be considered worrying approximately every 10 days. And these can be reflected inside. At some of the levels of internal pollution that we measured over the period of the project could be considered worrying. And it's just something that really should be looked into, and I think there's definitely more scope for work at internal pollution studies. Now, what you're seeing here is an example of a geospatial exploration tool that we've built on top. So this is an application that is driven off our data hub, and it allows you to explore, and it allows you to collate and collect data and look at the relationships between health, deprivation, and pollution, and all of the other aspects of the data set that we have available. The screenshot that I've selected here is really an example of that divide that you see in many cities, with the amber and the red representing more deprived areas. In fact, some of the most deprived areas in Northern Ireland are in West Belfast. And then the green reflects a more affluent group of people. So this is just a tool that you can use that allows you to select the data sets and explore that data sets and pick apart that relationship. So which brings me to the kind of the conclusion of why that would be useful and what you can do with it. And that holistic view and that consolidated view can sometimes be necessary. So on the left, you can see a strange graph. And I'm not a clinician, so I might pronounce these incorrectly, but it's a plot of salbutamol, which is a respiratory reliever, versus metformin, which is a drug used in the treatment of diabetes. Why would there be such a striking relationship between the two? Now, if you use our data sets and our tools to tease that apart, and you extract out areas that are deprived, you find that there is no relationship between salbutamol and metformin. It's not actually there. What you're seeing on the left needs to be very carefully understood, and it is a reflection of comorbidity in deprived areas. In West and North Belfast, unfortunately, you're much more likely to suffer from a respiratory illness and from diabetes, which is what we're looking at. On the right is another example where you can tease that relationship apart. And we have, in the red line, is the most deprived areas of Belfast, the salbutamol dosage over time. Now, there's a very curious thing happening around Christmas, which we'll ignore and I can't explain. But the key point to take away is the difference between that red line and the green line is 15 times more salbutamol is used in deprived areas of Belfast. So our analysis extends way beyond this, and I have many more slides that I could show. But there's always this kind of disparity. There's always this kind of link. And there's always this need to really understand the populations that you're studying and get the best data that you have geospatially. So you can't really discuss healthcare, for example, in any way without really taking into the context of the people that you're studying. So that was really a very quick sample of what we did with Clean Air for Healthcare and how we used it. And I think it's important to point out that most of the data that we have available in that data set is not restricted. And so it can be shared, and we are keen to share it. So if there's anybody who has interest in it, please do get in touch.